Okay, so what we've done is the history, the exam, patients left, and I've now gone through and completed the VO file. So the things you'll notice here is you've got the profile. So everything that we found that's relevant to that patient's file is in those profile notes. So we've got they are requiring a manual adjustment, they've got a suspected L5 disc herniation, they're not taking any medications, the x-ray has been referred for a full postural series and why. Once the x-rays come in, we'll put a summary of those x-rays under that, but at least it's been nominated why we sent them out. We've got the goals to improve the cervicothoracic and the lumbar discomfort, and we've also got to improve general health and well-being. Surgery is nil, trauma is nil. Problem number 1 is cervicothoracic and mid-thoracic pain. Just want to scroll down for me there, Luke. Problem number 2 is the lower back pain. No problems 3 or 4. We've got the schedule of intensive care twice a week for 4 weeks. We've got a diagnosis of mechanical back pain with associated degenerative change, postural deviation, and associated general health problems, including stress, diet, etc. We've got general exercises of walking, swimming, and cycling. Coming down, we've set a schedule to a week, which ends. It says 30th of 9th, 2016. That we didn't quite set it for that long, but it should be for about 4 weeks. Come across here, we've written in the file notes that they had an initial consultation. They presented with cervicothoracic and suboccipital pain and associated lower back pain. They had a full history and examination, and we've referred to the document manager. It will be stored up there under the document manager, which you can see the second tab, so we can refer to that. We've got no treatment provided. We've got referred for a full postural x-ray series due to the concerns over lumbar degeneration and subsequent postural deviation. And we've got a report of findings scheduled for Monday. What we've also done is we've filled out the report of findings folder, which you can see there. We've opened it up. Bit of information on chiropractic, autonomic nervous system. We've got C2, T5 and L5. We've got the somatic effects on the on the right hand side, and we've obviously got the structural effects on the left hand side. So we're tying in the organs with the presenting symptomatic issues. We've got then a description of what degenerative change is about. We've also overlaid the posture with the C2, the T5 and the L5S1 issues that we found on the examination. We've nominated that phase 2 is at L5S1, and it explains what the phase 2 degenerative change is about. We've got the schedule of care written here. Again, C2, T5, L5S1, an overlay of the posture. We've got the schedule of care twice a week for 4 weeks, progress exam in 5 weeks' time, rehab and maintenance to be advised. Supportive care of ultramuscles, and we'll put a brochure on ultramuscles with it, and we've got the general exercise being walking, swimming and cycling. We then skip to the back page. You can see that we've got the posture, and what we've nominated on the posture there is where the postural deviation that you can see has been nominated, and the fact that they're in the primary intensive care of their care phase, just reinforcing that.